Greetings, PsyQ community. Dr. Rachel Self here with Otsuka Neuroscience Medical Affairs. Today, we are going to be covering a very important topic, looking at the impact of COVID-19 on the mental health of children, an update from last year's discussion. This year's discussion is going to be featuring Dr. Mojgan Makki. Thank you for joining us today, Dr. Makki.
Hi, Rachel. Thank you for having me.
Dr. Makki is a child, adolescent, and adult psychiatrist who practices through private practice in the Chicago and Northbrook, Illinois areas. She also functions for the intensive outpatient program Solutions North Shore, as well as provides psychiatric consultation for many schools around the Chicagoland area. She's a distinguished fellow for the American Academy of Child and Adolescent Psychiatry, and she completed her residency at Washington University School of Medicine in St. Louis. Again, we are delighted to have you here with us today, Dr. Makki, as we cover this very important topic. So moving forward, we'll drop with the formalities and I'll just refer to you as Mojgan and we can have a nice chat.
Sounds good. Okay. Glad to be here.
This program is paid for by Otsuka Pharmaceutical and Lumbeck, and we are compensated for our time today, me as an employee and Dr. Makki as a consultant for us. So without further ado, let's go ahead and dive into some mental health disorders that are common in children.
Thank you, Rachel. I think we can start also by talking a little bit about COVID and mental health and just start with recognizing how unique and different this experience has been. And, through practice and working with schools, I have been involved at times with when a school closes for one reason or another. But this is definitely the first time that in my life, and I think for many of us, we saw a universal closure and a universal change in just the routine of life for the children and adolescents. And I want to highlight some of challenges that has brought for just all youth and all children, not just the ones with mental disorders and illness, but for all of them in regards to changes in the social interactions, the inability to go through that life experience of, social interactions are extremely element for children as young as preschoolers. And, at elementary school, the children learn how to do parallel play. And then as they get older, that play becomes even more significant in their stages of individualization and becoming into youth and adulthood. And I recognize, and we all recognize, that COVID had such a significant impact on that by creating this physical restriction that we all had to go through, but more specifically for the youth. Other factors that has been really important in looking at mental wellness of youth has been the fear that they have gone through. The fear of what if somebody in their family gets sick? What if they give the illness? What if they're carriers of the illness? And what if they lose, or, the trauma of losing loved ones that has been significant for some families. We also have seen a challenge in the health aspect. So like with school closures, it's also the access to some of the counseling services at school that has been missing. There are families that relied on the school for providing food or some supplements, and those are some of the other missing elements that we have seen in the past year and a half. So the studies that we outline here and where the science and evidence is going is to really look as much as we can at all these factors and see how each and every one of them has had an impact on youth. And separating what is the impact on youth in the general population and how different, if there is a difference, is that impact on children with pre-existing mental conditions and disorders. And those numbers, as we have discussed last time, we know that 1 out of 6 or 7 youth suffers from a mental disorder. We know that about 80% of adults were diagnosed before age 18. And so it was important for the studies and for our practices to look and see what has happened with the rates of mental disorders, the symptom presentation, and then to look and see what are some of the educational factors and protective factors that we can bring to our practices, to our communities, to help families and communities manage through the next couple of months as we go through yet another stressful time with the Delta variant coming and with all the uncertainties of schools reopening and figuring out how to be successful and do the best we can in those regards.
Absolutely. Thank you so much for that. I know in this particular slide, we're really just sort of stage setting, and you're alluding a lot to some of the more negative consequences associated because of the pandemic, associated with focusing on mental health. So, as you can see, and as you've been discussing here, we know that just in the general population, adolescents suffer from mental health conditions, and you can see some of the statistics there. But then the true aftermath, because of some of these consequences related to the pandemic, we probably aren't going to feel for a little while. But if you would, as we transition over to the next slide to get a little bit more deep into the details about specifically some of the negative impact of COVID on the mental health of children, if you could touch upon some of these points for our audience, I think they would find this very helpful.
There's been quite a lot of studies, and it's interesting to see universally we are targeting stress and the effect of stress on youth in relation to self-reports of depression, anxiety, stress, and then some of the other quantitative measures. And what I think is really amazing is that we've seen very similar reports come out of different countries and have come up from different cultures and races. And so when we look at all of them, we see that there is higher rates of anxiety, depression, and stress due to pandemic in youth. And this is not only self-report of the studies that send the surveys to youth and even to children, but it's also some good studies are coming from parent report that report an increase in, let me give you the specifics. There was a study in Spain and Italy that basically asked 1,000 parents of the Italian and Spanish children of ages 3 to 18, and 87 of the parents perceive that there's been changes in their children's emotional and behavior state during the quarantine. And some of that included difficulty concentrating, boredom, irritability, restlessness, nervousness, feelings of loneliness, which is an important factor. And I know that we're going to talk a little bit more about that in the future studies. And then worries and anxiety. There are some interesting variations in the studies. For example, I think in a study that came out of China, they reported more difficulties for girls compared to boys. In another study that came from US, reported more struggle in the Hispanic and Latinx communities. In the study from Spain and Italy, interestingly, the Spanish parents reported to have more problems. So cross-sectionally by itself, these are not exactly any larger studies that we can look at, but I think as clinicians, it is our duties to keep up with all these smaller studies and some of the systemic reviews that are occurring through the next few months, and just recognize the risk groups and the risk factors. One of the studies that I really thought was important and the questions that was important was the impact of family on the stress and the outcome measures, and whether or not there was a difference with the degree of stress and the impact of stress dependent on the parent-child relationship. And of course, by no surprise, in all the studies that we have seen so far, a strong parent-child relationship has been seen to be a protective factor. Discussions about COVID, normalizing the stress that COVID has caused on us is a protective factor. Validating the feelings that it is expected to feel anxious, it is expected to feel stressed, it is expected to be angry, to feel lonely. Those have been across the board some of the strong protective factors that I think we can use those as we move forward with supporting our families and supporting our community to continue to provide that education for the parents and for the families, for them to understand that it is so important to continue the conversation and to continue talking about how we know it is going to be unpredictable and that it is okay for us to feel frustrated, it is okay for us to feel stressed, and it is okay to recognize that we're probably not going to do the best that we can do if it wasn't for COVID, and that there is a conversation about catching up, catching up with our academic performances and our social performances.
Thank you so much, Mojgan. I think that you've really covered a lot of the high points here very well. And I think it provides a nice discussion. I know we would like to hear a little bit more from you. Several slides from now, we're going to talk a little bit more about the role of parents in COVID for our young adolescents and youth. But to kind of backtrack just a little bit and talk about some of those adolescents and children who had pre-existing mental health disorders prior to the pandemic, I know there's information coming out about what type of an impact it's having on those that had pre-existing mental health challenges. So if you could touch a little bit on that for our audience, I think they would enjoy hearing from you.
Yeah, we are hearing a lot how difficult it has been for the children and for the parents to go through homeschooling. We see that, especially with inattentiveness, it's been very difficult for the children and for youth to stay on top of their schoolwork in a virtual format. It is easier for them to become distracted with looking at other sites online as they go through the online virtual classes. And it's also been a lot easier for them to end up with the daydreaming part of ADHD, inattentive type. And of course, as clinicians, I see that often as I do my telemedicine appointments, that it can become difficult interviews, especially for the younger kids and their difficulties with inattentiveness and restlessness and fidgeting through the 30, 60-minute appointments has been as challenging for them as it is going through a 30-minute classroom in a virtual setting. So I think those are some of the facts that we see. And, if you think about impulsivity, we have data to suggest that parents report difficulties with their impulsive kids, staying appropriate with the social distancing in the stores, being able to keep their masks on. So that by itself brings additional stress and additional anxiety for the parents and for families. Obviously, we know that children with ADHD are at higher risk for having comorbid psychiatric diagnoses, and it is important for us to educate our parents and educate our patients and our youth to recognize that they need to be aware and they need to be cognizant if their child starts presenting with emotional concerns and with changes in their emotional behaviors. I think there was a study that came out of Turkey that talked about an increase in OCD symptoms since the COVID, and other studies have come up that talked about increase in depression and anxiety. Interestingly, there have also been studies that talked about self-reported studies that folks with anxiety, particularly the internalizer, anxious kids, reported feeling less anxious as they have gone through the quarantine and through homeschooling. So I think that's one area that we see the socially anxious patients that we have and socially anxious youth are feeling less stress as that requirement is taken away or has been adjusted, and they are feeling less anxious about that. And I think that's an important area for us to recognize as schools are reopening. And now they kind of have to figure out, and we have to support them as to how to re-enter schools.
You bring up some really good points there. And I know, we've heard that for adults as well, that some are typically a little bit more socially anxious. The pandemic and staying at home has almost kind of given them a pass, and it's okay not to have to put yourself in those situations. So it's interesting that we're sort of seeing that mirroring effect in our children and adolescents who have those types of social anxiety as well. And another caveat along with that, as we transition to the next slide, I think brings up another issue that's sort of related to that. Since we're home, we have been home so much. You don't always have to necessarily do the same types of daily routines that you would if we were in pre-pandemic years. So I think it's kind of interesting to take just a moment, and since we're on this conversation, to talk about, this different type of approach where, maybe our children and adolescents become a little less prone to respect daily routines that we've also seen happen in adults. So could you touch on this for our PsyQ community?
Oh, it's huge. It's a huge conversation. And it's it's a conversation that is fluid and that we have to recognize to adjust it to the time. So it's been always during summertime, we are more flexible with scheduling. We allow our youth to stay up late, stay in bed longer, have more TV time or have more screen time. But the numbers and the significant change we have seen in the past year is mind-blowing. I think in one of our studies, we saw that the physical activity number was reduced from 9 hours a week to 2 hours a week. And that's huge. And we know that physical activity is not only a good outlet for stress, but it also is an important factor for the medical health of our youth. We know that it definitely has an impact on obesity, cardiovascular health, and other long-term effects that we have to keep an eye with our youth. We know that screen time has gone up from 10 hours a week to 40 hours a week. And we recognize that some of that screen time is our youth completing schoolwork. But there is, even when we took that out of the picture, there is still more than doubling of the screen time. And it's really important for us to look at those measures and to think of ways that we can gain some control back, and we can encourage our youth to gain some control back, to increase physical activities by looking at some safe options of physical activities, maybe going out for a walk every day, maybe getting on their bikes, and for public health to bring the conversations that physical isolation does not exactly mean less physical activity. And as community, we can still find ways to engage in physical activities without putting ourselves, our loved ones, and our communities at risk. Similarly, with the screen time, there can be conversations to make it a more structured activity. And we talk to our families about thinking of screen time in 3 separate sections. One section is for them to complete schoolwork. So if we continue with the virtual schooling or hybrid models, we need to set specific time in the day that our children and youth are scheduled on the screen to complete their screen work, and we have to help them to stay focused and concentrate on finishing the schoolwork, giving them breaks every 30 to 50 minutes, depending on the need of the youth and child, and providing a specific area in the house as if it's a classroom that they know this table, this desk is where I go to complete my schoolwork. So that's one part of screen time. The second part of screen time is leisure screen time, for fun and activities, text messaging, and watching something funny, watching some movies, or watching their favorite shows on TV, which has the same and similar challenges as it did prior to COVID. And for families and parents to be aware of their child's temperament and to recognize what would be some appropriate programs for them and what would be not so good for them to watch based on their temperaments, and really to be attentive to making sure that, for example, if they have anxious kids, they're not watching too much of the news, and also making that age appropriate. The third part of screening time would be related to if it's used as a coping mechanism, if it's used to lower the level of stress. And I think that's the area that we can make a huge impact by allowing them to listen to programs or watch programs that is empowering and gives them tools and ideas, hearing experiences of others to help them manage through the ongoing stress in a more effective and in a more successful way. And those would be some podcasts that are, or state organizations, community centers. I know that in my area, schools provide really good support services through online programs for the youth and for the parents. So to really use those to bring the support to fight against feelings of loneliness and feelings of stress.
There's so many different aspects involved here, so thank you for your perspectives on that. And I know you've touched upon quite a bit of information that's covered throughout the slide deck. So I think since we're talking a little bit about schooling, if we could transition and talk a little bit more about some of the impact for the homeschooling, and then now as we're facing the Delta variant and perhaps having some other restrictions put into place as we're talking about reintegration into the school. I would love to hear some of your thoughts on this.
We have definitely seen a challenge for the children and youth with the transition into the virtual schooling. And I think that as schools start up, the families and youth have a lot to catch up. And I want to go back to this idea of catching up and to normalize that it has to be considered as step by step, and that they could still be quite a lot of difficult times ahead of us, and many areas that we have to stay flexible and we have to be ready to adjust very quickly. The idea of catching up is to really, within the environment that we are, to help our children understand that physical distancing is different from social distancing. And it is so important for them to continue to catch up within the safe environment that we can provide, to reconnect to their peers and reconnect to schools and to the environment at school, and have the conversation with them that this will not be the same as it was in 2019. Our schools are still going through changes and figuring out how to implement the safe school environment, and that we have to have the conversation with our children and with our youth to be mindful of that and to be respectful of the arrangements and to stay fluid with it. The other aspect of catching up is the academic catch up. We had a discussion earlier about how some kids and some students have really been behind with school in the 2020-21 academic year, and many of them have actually done a really good job with going to summer schools to help them catch up with some of the work that they needed to do the previous years, and then to also get them started on a stronger note for the 21-22 school year. So I think there is still a lot that is unknown. I think it's important for the families to continue the conversation with schools, to bring their concerns, and if they see their children going through emotional difficulties and presenting with changes in their behavior or presenting with frustration, to really have that conversation and communication with the schools.
And I know you've spoken quite a bit for our PsycU community about being able to align and collaborate with the school system. So I think that's a really good thing to keep in mind for those children and adolescents and parents out there who might be listening. So thank you again for reiterating that. So if we could dig a little bit deeper as well into maybe some of the social isolation and loneliness. And again, it's so interesting that we see this a lot in adults, but then the mirroring effect, or even perhaps an exacerbation of some of the impact of the social isolation and loneliness on our youth. Could you speak a little bit more about this for our PsycU community?
This has been a very interesting and, a really important discovery for clinicians and for the families to think of how are we measuring social isolation and what are the impacts of this social isolation. And in addition to looking at, well, there is an increase in anxiety, there is an increase in depressive symptoms. What is one thing that we can take away to say that would be my cue to think that this youth or this child needs a little perhaps more intervention or a little more support? For example, we know when we talk about depression, we really stay a little bit more focused on the word hopelessness. And we ask our patients often if they feel hopeless, as that is identified as a risk factor. In studies that has come up from COVID, we have seen that loneliness is a risk factor for increase in symptoms of depression and anxiety. And there's been a couple of really good studies to show that. I encourage the viewers to look at to read the study that was at the ACAP journal I want to say in December of 2020 by Dr. Lotus, that really did a rapid systemic review of all studies that talked about loneliness in youth for the past 60 years, I think, that she really looked into it and found that social isolation and loneliness increases the risk for depression and possibly anxiety. And that duration of this loneliness was strongly correlated with the mental symptom, and that the duration was more important factor or more significant factor in the studies than the intensity of it. And it really brings us to the idea that increasing awareness into, again, the physical isolation doesn't have to be the same as the social isolation. And that if we see in our clinical offices of children reporting of symptoms of loneliness, to be more attentive to them and to make sure that the parents have an understanding to have the conversation with them. Adolescents who felt lonely reported experiencing more mental health symptoms, and that the parents that could talk to their children and have that positive relationship, that relationship decreased the risk of loneliness, which by itself was somewhat of the protective factor.
And that's so interesting. So since you're on a roll and we're talking about the role of parents, and let's go ahead and dive into this a little bit deeper. You alluded to some of these statistics and some of these specific bullets earlier, but if you could give us a little bit more insight into exactly what parents can be doing to assist, or maybe even what they shouldn't be doing to prevent any kind of increasing deleterious effects on their kids.
You know, we touched base, as you mentioned, about the importance of the parent-child relationship. And this is nothing new to mental health in child and adolescent psychiatry. We know that the relationship is an openness is an important protective factor. And we talk a lot in my program at Solution North Shore about like recognizing what our temperaments are, what the temperament of our child is, and really to try to adjust that parent-child relationship based on what we know of our child. And for families who have more than one child, we know that the same parenting style does not necessarily work for every child, and there has to be adjustments in how we parent and how we provide that balance of discipline, structure, with warmth and empathy and support. Some of the general ideas of parenting is conversation, and to keep talking about stress, to keep talking about anxieties and changes that we all go through, to recognize that it's important for the children to hear from the parents that they feel stressed, they feel anxious, they are trying to, just like them, figure out how to manage all the changes that is happening in our environment, and that they don't all have all the right answers, and really bringing the family and the children in the conversation as to, let's figure out how we can best manage the current situation. How can we increase our physical activity? How can we be cognizant to make sure that the screen time is appropriate and is going to support us with our plans for short term and long term, and really to include them in the conversation. And of course, we do that differently when we have a youth and a teenager as compared to do a child, but it has to be a conversation that would happen with them. We like to encourage our families to open the conversation and to allow the youth to talk and allow them to come up with solutions instead of finding ourselves as the role that as parents we need to come up with the answers and we need to come up with the solution, but really fostering a conversation that supports the youth and supports the child and helping them to come up with a solution or with a strategy and have that conversation with them. Lastly, I think that it's important to know that it's never a good time to talk about mental illnesses and mental disorders. We have had the conversation in our previous recordings that talking about depression and anxiety and mental disorders is not easy. It's never comfortable, and there is no time that would be a good time to talk about it. But it is so important to have those conversations and use our daily experiences to open the conversation about us, to give examples as something that happened today to us and created a feeling of anxiety, a feeling of stress, or even a feeling of happiness, and really opening the dialogue to be comfortable, to recognize the feelings, to talk about those feelings with our children, and helping them understand what those feelings are and normalizing it, that it's okay for them to talk about it, and that validating that those feelings are okay to have. And if at any point those feelings become so strong that they cause impairment in our routine and daily activity, for us to seek consultations with schools, with physicians, or if there is a counselor or psychiatrist involved with them. Outside of talking and conversations, going back to the slide that talked about the routine, it is so important to start getting that routine started now that we are 2 to 3 weeks away from school. It's important to let our community and our parents know that getting back to routine cannot be a fact that we do overnight, that we need to start that conversation now. We need to start saying, it's summer, sleep time is at 11 or at midnight. As we're getting closer to the start of school, let's talk about how we can shift that back to be ready by the time school starts, and really to have a plan to shift it back by, let's say, 1 hour earlier sleep time, maybe 1 hour earlier wake up time, and bring the child or the youth into that conversation to give them the ownership of having that plan and really focusing on getting themselves ready for hopefully re-entering into schools in person.
Yeah, those are some really fantastic points. I was processing everything you were saying, and I think, it just really drives home most of our problems could probably be solved with continuous, clear, and open communication, right?
Mhm.
And so I think that stressing that point is so important, and having that back and forth dialogue, because sometimes our adolescents and children, they can just be so creative. They're not so stuck in the regimented ways of doing things. So they can come up with some very creative solutions to work with what we've got now, right? To work with what we've got in our current situation. And then remembering to the last few points that you just made, that we need to be patient with ourselves. We can't expect everything to, go back to that quote unquote normal that people have been pining after. It may not look that way again, probably won't look that way again. So we just need to be patient and find a solution and a set of daily routines that is going to work for us and for our families, right? So I think those are fantastic points that you just made. So thank you for sharing all of those. And I think it provides a really great transition for us to move and talk a little bit about some supports and some specific types of interventions that we might be able to turn to right now for those parents and youth and adolescents who might be needing a little bit of extra support. So could you speak a little bit to some of the psychosocial interventions that are covered on this slide?
Absolutely. And I think that you brought a really good point that this has been a devastating experience, but there has been also some silver lining to learn so much from our youth. And it's so important now more than ever for us to listen to our youth and listen to our children and to find out what part of this change and what part of this experience they think has worked for them. And what are some of the areas that we could actually incorporate into our lives and into our routines as we move forward, hopefully, to be done with this pandemic. And one of those areas is actually the benefit of virtual support system, the benefits of programs that youth and children and parents can use as a ways to support them, podcasts that we can listen. And I know that we have some of them provided in this slides, which basically, if we go into any of the community centers in our local community centers or the larger national organizations, there is many different layers of support that can be provided. And I encourage our families and I encourage our clinicians to provide those outlets for the families. I think schools and school websites often have really good programs that are virtual programs to provide support for the children and families. Community programs in areas are one other example of them. And really to use what we have learned so far in creating better studies to continue to look at the outcome measures that we see with mental health and mental wellness in our community.
Perfect. Thank you so much. And I know that you have provided quite a few conversations for us in the past, and we will make sure that everyone can take advantage of listening to some of those where you've talked about some of our supporting organizations for PsychU and some of the different great resources that are available out there, as well as some of the things available through the American Academy of Child and Adolescent Psychiatry. So we'll make sure that that is all tied together here so people can take a look and take advantage of some of those supportive resources as well. So it's hard to believe, but we are getting close to the end of our time together. So if we could transition here just for a second and have you provide some concluding remarks for our PsychU community.
I think that, we talked a lot about prevention actions, and the prevention comes with education. So as mental health clinicians and child adolescent psychiatrists and us working with youth, it's so important to collaborate with our families, collaborate with our schools and our community centers to continue to bring the dialogue, to continue to bring openness and conversations, not just about mental disorders, but about mental wellness and mental health. The importance of having a structure with good sleep hygiene, a balance between physical activity, use of internet, social media, and what we see and what we use in there. And I do this in my practice every day with just collaborating with schools to bring that knowledge and education to not just the youth, but also to the parents and to other providers. Pediatricians have been a great resource for us always, and specifically more during the pandemic, as we know that our schedules have been very busy and the demand is much higher than it has been in previous years. And I only suspect that that will stay the same through the next few months. And it's really important for us as folks expert in the area, expert in child and adolescent mental health, to continue to have strong collaborations with the community, with other clinicians, and with the schools. Talking about mental health, normalizing is really important. And some of these factors are enough to give the support that the families and youth requires to manage through the next stages of the pandemic and to stay healthy, happy, and successful. For those with higher degree of symptoms, I really encourage those families to reach out to the community centers, to reach out to schools, to reach out to their primary care physicians. And one area that has been different this year, but actually now is to our benefit, is that we have all gotten used to virtual appointments and telemedicine. I know that in my state, telemedicine is now approved as a modality for clinicians to continue to see their patients. And that by itself opens such a huge opportunity for us clinicians to be able to provide service to more number of patients as we see the challenges going on. So I'm really glad to see that as a platform and as an opportunity for us.
It is great, and it's, we're all going to have to learn how to adapt and just learn how to function in sort of this hybrid setting that we have found ourselves placed in. So thank you so much, Dr. Makki, for all of your time and your insights today. We really appreciate you sharing your perspectives with us and giving us some of these statistics and update on the studies and some support organizations and some support tips for our parents and our youth out there who might need a little bit of extra support right now. So thank you so much for that. We thank our PsyQ community for joining us today. And we would like to go ahead and let you know that we are going to try to provide all of these resources for you. As you can see, we have a number of different resources that we will try to make available for everyone. There are some specifically targeted for our youth, our children and adolescents, and some specifically targeted for parents. You'll also notice on the left-hand portion of this particular slide, we're just going to go ahead and remind you that we do have a mental health and children infographic that's available on PsyQ, and we have a very nice discussion with Dr. Makki walking us through some of the statistics and some of the supporting organizations and their work and how you can embrace some of that and perhaps tie into some of those group support resources that are provided there. So thank you so much again. And I want to remind everyone within the audience today that you can stay up to date with our PsyQ app. You can download that and have everything in a one-stop shop for you. And you can take a look at any of the upcoming webinars, live events, on-demand discussions that we have on the PsyQ app. So if you haven't downloaded that, please take the opportunity to have everything in one spot for you on your phone. And again, just thank you so much. We really appreciate everyone's time. You can always find additional resources on psyq.org. And you can check out some of our previous conversations with Dr. Makki on the PsyQ website. Thank you again for your time, and we hope everyone stays well out there as we continue to appreciate the impact of COVID on the mental health of children. Thank you. Have a great day.